I also wanted to ask some questions on the Children's Health Insurance Program. At what % of poverty level are we funding that program under the budget as it's proposed today?
You're talking about CHIP?
Yes.
Yeah, at 200%, I think.
Okay, and it is the case, isn't it, that at the federal level, authorization was provided to fund CHIP at a 300% of poverty level?
It is.
Okay, and what would the cost difference be between providing that at the 200% poverty versus 300% that's been authorized?
I'm not advised. I bet Senator Averett's probably getting ready to tell me since it's his bill. 30 or 40 million.
30 to 40 million. And I know that Senator Averett has a bill that he's proposed, which I've signed on to and fully support. It's a very, very good bill. Just curious as to why in our $3.1 billion addition of funding to Article 2, why it is we made a decision not to prioritize the full funding of CHIP that would allow that federal drawdown of monies.
Well, I think the reason is priority, Senator, that if you look at the people that would be included, and I actually philosophically support that type of thing. I had a Medicaid buy-in bill for disabled people. I have a Medicaid buy-in bill for families with disabled children. But we felt that giving the incomes and demographics of the people that would be in that 200 to 300 range, that they weren't in as much need as some of the folks that you heard some of the things that we weren't able to fund due to budget constraints. It was just, again, a matter of priorities. A family of 4 at 300% of poverty is $66,000. And we felt there were people, many, many more people that were in much worse shape that needed our services more.
And I understand the challenges that you face. And I guess the question I ask really is not so much so of the work that you and your group did on Article 2. It's a broader question about the budget as a whole in terms of the priorities that we make there. And I just want to say for the record, it is going to be very difficult for me to go home to my constituents and say that I was able to support a budget where we did not fully capture, did not fully realize the federal drawdown that we could receive under CHIP, under that 300% poverty level. And I'm hopeful that with passage of Senator Averett's bill, we are going to be able to say at the end of the day that we're going to fund that.
And it would be hard for me to go back to my district and explain to people why I used their tax money to provide health care insurance to people that make $66,000 a year. So, I mean, we just didn't have the money to do it this time, and you know, that's a broader issue, as you mentioned, about health care in general. How much is government supposed to provide for health care? Some people say none, some people say all, and that's the debate that's on the floor now. But I would submit to you that there are people at those income levels that we're talking about that probably do have access, and they just haven't made an effort to find it. I see that all the time. When I ask people, have you tried to find health insurance, and they say no, they're just either waiting for government to do it or assume that they can't do it. But I appreciate your question on this, and if the bill passes, and it hasn't passed yet, as I think Senator Ogden pointed out, any bill that passes, either the House or the Senate, will get consideration in conference committee. So it's not a dead issue yet.